Hello, welcome to AMCI Saturday Study Session, or SSS. I'm Mrs. J, Curriculum Director here at AMCI, and I am delighted to present AMCI Lead Instructor Ms. Tamika along with her guest. Without further ado, let's get started. Take it away, Ms. Tamika.
Good morning. How is everybody? Hey, Miss Tamika. Oh, you got your large cup of coffee. Hey, I've got my green energy tea. I think we're set. I think we're set. All right, so you're listening in this morning. That is fine. We still got lots of good stuff for you. Hey, Miss Cheryl, good morning to you. It is always a pleasure to join you, ladies. Hey, Giovanni. I hope you guys are just doing amazing. We're going to jump right in. But before I do, I'm going to have Miss Tina come on and say hello, and then we're going to start rolling. Oh, we're going to jump right in with our copyright, CPT copyright 2020 American Medical Association, all rights reserved. CPC is a registered trademark of the AAPC. AAPC content found within this presentation is copyright of AAPC. Keyword concept, FTR, CHUN, AMCI FAB 7, AMCI ICD 10, flip, tap are trademarks of AMCI. All righty, our agenda for today. We've already done our introductions. We've done that copyright. I just want you to simply remember your steps for solving a time scenario. At this point, I know you know what to do. That's why I've just summarized it here so we can jump right in into the meat of the matter and get to those scenarios. Remember your key word concepts, okay? Remember those steps again, and your FTRs, your facts. To remember, you should have those on the corresponding pages that go along with the codes that reference your FTRs. And then we're going to get to the time scenarios. And like I always say, let's do this. All righty. Hey, real quick. I don't know how you guys turn your pages, but I'm always trying to just share some things. And I thought, let me just give them a picture. However you turn your pages, if it works for you, that's fine. But for me, I found an efficient method of page turning. It could help to locate your codes faster and save some time. So make good use of just the tip of that page when you're thumbing through. It could get you there a little bit faster if your brain clicks that way. Okay, so if that doesn't work, that's okay. There are many different ways to get to where you need to go in that book, but I just thought I'd share one of them that's always worked for me. All righty, don't forget at the end to please leave us your feedback. We want your feedback. You guys already know why it's important. It is imperative that we deliver quality classes to you, and your feedback, it enables us to do so. It helps your instructor help you. I want to give you the best experience possible and to address whatever concerns you have to make your study time efficient. No feedback means no good. Hey, we can do a lot of things, but reading minds, that's not one of them. So please share your thoughts so that we'll know how to make this class the best it can be. All right, we're going to jump in. And I'm going to have Miss Tina come and read our first scenario. All right, we're going to hop in here with some anesthesia. All righty, it's on you, Miss Tina. And for this one, it is so short. We're going to do 2 minutes on this one, okay, after Miss Tina reads your scenario.
Report the appropriate anesthesia code. I'm sorry, I start with the answers first. A 01962, B 01963, C 01968, and D 01967. Report the appropriate anesthesia code for obstetric patient who has had planned general anesthesia for cesarean hysterectomy. You have 2 minutes and your time starts now. You probably won't need 2 minutes, but your time starts.
All right, I see those final answers coming in there. I was hesitating just a little bit. I wanted to be sure everybody was in there, and I think I've seen everybody pop some answers in here. So we're not going to spend too much time on this one because everyone has arrived. At B, we had just a few people that just need to just have a little nudge, very close. Sometimes it's easy to sometimes miss just a little subtle something with a code. So we have an anesthesia code, an obstetric patient, and this is for a planned general anesthesia for a cesarean hysterectomy. So we're going to take a look at what we have. All right, so we're going to start out with honing in on the fact that this is planned, a planned cesarean hysterectomy. All right, so since it's planned, anesthesia for urgent hysterectomy, that would not apply. So the 01962, we're going to take that one away. All right, we're going to continue on with our codes, and we have anesthesia for cesarean hysterectomy without any labor anesthesia care. All righty, without any labor, no labor because it was planned. All righty, so yeah, they didn't go into labor. This thing was planned, so we're going to hold off on this one just yet. Let's take a look and do our due diligence to be sure this is our best case. What about this one right here? I would say we probably should have taken that one off from the very beginning. And why would this one be taken off right away? Okay, if you can look through your codes and see something you can eliminate, get rid of what? What is that? That's right, Dana. Yeah, get rid of that add-on code because it can never stand alone or be first. All righty, so we're going to take that one away, and this one we could always get rid of immediately. We'll go on and take a look at 01967, the neural axial labor anesthesia. There was no mention of that. Again, we're always honing in on those keywords, and none of these would apply. So we're going to take this one off because, yeah, it was not a planned vaginal delivery. So, hey, we have a lot of things that are not matching up with that code. And thus, yeah, we can rest assured that 01963, that is indeed the most appropriate code in this scenario. All righty, so you guys did outstanding on that one. We're going to keep on going, okay? Because I want to be able to save time for some things that might require a bit more explanation, and you guys already nailed this one. All right, so for this one, I'm not even going to mute myself. I'm going to have you guys, I'm going to give you like 30 seconds, and I want you to tell me which physical status modifier will best describe a patient who has severe systemic disease that's a constant threat to life. You know where to go in that anesthesia chapter. All righty, so we're going to take a look at P1, P2, P3, or P4. I want you guys to tell me which one. Yes, I see you in there, Miss Dana. I see Andrea. Yes, I see Cheryl, Aisha, Renita. Yes, everybody's popping those answers in there. Like I said, we're not going to waste a moment of your time today. And I knew this one would just be a breeze for you. I just want to be sure you got your thinking caps on and you're ready to roll. I see you in there, Miss Cheryl with Nada, and I see Giovanna and Erica. Yes, you guys already know it is P4 for the patient status modifier for severe systemic disease. Okay, so we're not even going to go through all that. You guys already know it is D. All righty, so there we go. Now we're going to get to the meat of the matter with this one, and we're going to concentrate on some anesthesia time. And I'm going to have Miss Tina come and read this one and then give you your 2.5 minutes. All righty, come on, Miss Tina.
Okay, answers are A, 7:14 a.m. to 8:18 a.m., 64 minutes. B, 7:14 a.m. to 8:29 a.m., 75 minutes. C, 7:26 a.m. to 8:18 a.m., 52 minutes. And D, 7:26 a.m. to 8:29 a.m., 63 minutes. Anesthesia starts to report as 7:14 a.m. and the surgeon began at 7:26 a.m. The surgery finished at 8:18 a.m. and the patient was turned over to PACU at 8:29 a.m. which was reported as the end anesthesia time. What is the anesthesia time reported? You have 2.5 minutes.
All righty. I think most of you have arrived at that answer. I'm loving what I see. And so we're going to go ahead and solve this scenario, okay? I think most of you have gotten it. I had a few questions, and so I'm going to clarify those when I give you the explanation, okay? So we're going to start with it. You guys have already solved it and know that it is B. And so for those of you who solved it and had a few questions about making sure you're clear on that time, we're going to go ahead and solve it. So you already see your start time is indeed 7:14 a.m. And then the surgery began at 7:26 a.m. They finished at 8:18, and this patient was turned over to PACU at 8:29 a.m. And then that was reported as the ending anesthesia time. Okay. And so the thing that you're going to want to always keep in your head is did the anesthesia, when did the anesthesiologist or the anesthetist take over to begin the anesthesia prep and everything? When did someone that does anesthesia start it? Okay, so you're honing in on that. And when was the patient turned over to PACU? Okay, those are the things. It's fine with the surgery finish time, but when was the patient turned over to PACU and no longer under anesthesia care? Okay, so and it reminds you here that your anesthesia start time, it begins when the anesthesiologist begins to prepare the patient. And remember, it's the anesthesiologist. Okay, they have to specify that that's who began, or if they don't specify that, then you're honing in on the anesthesia start time. Okay, and then it ends when the anesthesiologist or the anesthetist is no longer in attendance, meaning the person has been turned over to PACU. All right, so that prep time, the anesthesia start time is 7:14. And then we see that in those two answers, but here the 7:26, that's simply when the surgery started. So Nope, that's not going to help us with our anesthesia time. So you could take that one off the table. But when was that patient turned over to PACU? That anesthesiologist is no longer present, and it is indeed 8:29 a.m. Alrighty, so we see that in B, but we don't see it in A. This is when the surgery finished. So that one's gone. So you can see how, yeah, you can quickly eliminate certain answers just based on having a firm grasp of that concept, the start time and when the anesthesia end time is, okay, which is when that patient has been turned over. So we're going to take the 7:14 to 8:14 a.m. That's 1 hour, and we know for every hour we have 60 minutes, and we know that time is split up into 15-minute increments, so that gives us 4 units of time. But we also have the 8:15 to 8:29 a.m. That's 15 minutes. So we have an additional 15 minutes. And so we have 1, 2, 3, 4, 5. We have 5 units, 75 minutes. Okay. All righty. So all right. Yeah, yeah, Miss Cheryl. Yep. You got to finish that scenario with that ending. Yep, with the ending time. All right. So I think everybody's good. I think many of you solved it. I wanted to just be certain that you're clear on as you see it that you can use that concept to quickly eliminate some answers as well. Okay, because you're going to want to, really shave off some time as you progress through the exam. Alrighty, so we're gonna keep on moving, and we already talked about every 15 minutes. Yep, that's 1 unit of time. Alrighty, so I'll read your next one. We're gonna do some more anesthesia. Now we're gonna solve. Okay, so we have A, 1200. We have B, 1,000. We have C, $1,100. D, $900. So for code 00731, anesthesia for upper gastrointestinal endoscopic procedures. Endoscopes introduced proximal to the duodenum, not otherwise specified, has a base unit of 5. The patient is a P3 status, which allows 1 extra base unit. Anesthesia start time is 7:37 a.m. and the procedure started at 7:50 a.m. It finished at 8:35 a.m. and the patient was turned over to the PACU at 8:52 a.m. So using 15-minute time increments and a conversion factor of 100, what is the correct anesthesia charge? Okay. All right, coders, I'm going to give you 2.5 minutes on this one, and your time, it starts now. All righty. So we are at the end of the 2.5 minutes, but I want to give you guys just a little bit more time, maybe about 10 or 15 more seconds for a few more of you guys to get your answers in there before we start to explain how we arrived at our final answer. All righty. I know you guys are working hard, so I'm gonna just quiet myself and give you guys a little bit more time. All righty, we're gonna go ahead and jump in there. Alrighty, so here we go. All right, and no worries, guys. Like once you get this concept down, you'll have it. Okay, you're gonna have it. No worries, and it's not gonna take a whole lot of math. If you're like my daughter, she starts to cringe and sweat. We start talking about some math. So your answer is indeed C. So our anesthesia charge would be $1,100 with this scenario. So we're gonna take a look again at how we get there. Alrighty, this is coming from our code series of 00731. It's for anesthesia of the upper gastrointestinal. We need a base unit of 5, okay? And we have a P3 status, and that's going to allow that one extra base unit, okay? Yes, Renata, you're with my daughter, huh? The anesthesia start time, it is 7:37 a.m. and the patient is turned over to PACU at 8:52 a.m. And so again, like these things are fine when it started, when it finished, but I'm showing you what you need to hone in on in order to calculate the proper time. And so I always hone in on the anesthesia start time, and then they're turned over at 8:52. All right, so we're going to cut to the chase. And again, we need those 15-minute increments, and we're going to need that conversion factor as well. All righty, so we know that because we've got to use this formula. We've got the base, that's always given. The time is what we have to calculate. Your modifying factors, those are you're either going to be using your physical status modifiers or the qualifying circumstance codes, those add-on codes, those will alter it as well. And then we have the conversion factor. That's going to be given to you. Okay, so our base is indeed 5. All right, it tells us that. And then we have the time. We're going to solve for that. The modifying factor, okay, is 1. It tells you right here we have that extra base unit of 1. Remember, we have that P3, and I know you've already got it churned, and it lets you know we get 1. We get 1 extra base unit for that, okay? And then we have our conversion factor, and here we go with the anesthesia start time and then the PACU. Okay, so we're going to solve for this one and then we'll plug that in. So we've got the end time, which is the 8:52. We've got the start time of 7:37. We need to get the difference between the two for that time, and it leaves us with 1 hour and 15 minutes. Okay, so we know how we're going to count it. So we've got 15 minutes, 15 minutes, another 15, another 15. Because let me ask you, if you have 1 hour and 15 minutes, how many units of 15 do you have within that? There you go. Yep, you got 5. Mm-hmm. Yep. Once you figure out that time, you know what your anesthesia time is. So we've got 7:37 to 8:37, and then plus the 15 minutes, which is the 8:37 to 8:52. So yes, we've got 5. So we plug that in. All right. And then we have our conversion factor, and that is, there we go. The conversion factor of 100, because we're going to add 5 plus 5 plus the 1. That's how we got the 11. And then times the 100. And then that gives us our 1100. Okay. And that's how we get there. All right. All righty. Yeah, yeah. You know what? Once you can do the minutes for the time, but once you do the minutes for the time, now you've got to divvy it up into 15-minute increments. So that's fine. You could do the minutes. You could get this and have 75 minutes, but then you need to divide it by 15. And remember, when you divide it, if you're over even by 1 minute, that's an additional unit. So if you were to get an hour and 16 minutes, then tell me what would your time be? Okay? That's right. That's right, Renata. That's right. If it went over just by 1 minute and you were now at an hour and 16 minutes, then you would have 6. Okay? So it has to be 15 for anything that's left over, even if it's a minute, if it's 2 or 3, if it doesn't even if it doesn't hit 15, but you would go over, you would need an additional base unit. But I assure you, pretty much all of the things that you would see, it's gonna be an even 15. Okay, so is everybody good now that had a few questions on it? So yeah, you can either get it based on how I have it, or you can use the minutes. That's fine. Okay. All righty. Yeah, sometimes when I was learning it, it would it would come and go. Some days were better than others. I was like, I thought I had this. And so yes. So if you need to get a screenshot of this one, you may, and then we're gonna move on. Okay. All righty. So we got C. I'm going to read this one, and then I'm going to have Miss Tina come after this scenario, and she's going to read us out for the next 2 after this one, because we got to split this work up today. All righty, guys, we have one more. Don't let this one shake you, okay? Don't let it shake you. All right, we have A 01952 with a P5 modifier. 01953 with a P5 modifier times 5, 99140. We have B 01952 with a P5 modifier, Z1953 with a P5 modifier, C 01951, 01952, 01953 times 4, and finally D 01951, 01952, 01953 times 4, 99140 with a 51 modifier. A patient with third-degree burns over 54% of his body is being treated under anesthesia for excision, debridement, and extensive skin grafting. The patient's condition is listed as severe, and he is not expected to survive without the operation. The operation is further complicated by the emergency condition of the patient, and delaying this procedure could lead to loss of body parts. How should the anesthesiologist report his or her services for this procedure? All right, coders, I need you to just take a deep breath, breathe in and out, and I'm going to give you 2.5 minutes on this one, and your time, it starts now. All right, I saw some amazing answers in this chat, and I see a lot of explanations. You guys are thinking it through, and that is terrific because that is going to be needed. Anything that you can do to quickly eliminate some answers on site is most helpful. All right, so I'm glad you didn't let this one scare you away. For some reason, burns used to scare me away. I mean, I had to get my mind right in order to do burns. If I saw anything about burns, I'm like, oh man. So, hey, you guys weren't fooled. You weren't fooled at all. So, indeed, you guys have already said that A is the correct answer. And so, we're just going to quickly go through how we got there. As most of you have already figured out, there were several ways to get to this answer. So, one way to solve it is we're going to go through there are third degree burns over 54% of the body, treated under anesthesia. The patient's condition is severe. Okay. They aren't expected to survive without the operation. So this is indeed emergent. All right. So how do we report the anesthesiologist services? All righty. So for this first code 01951, indeed, this common language is correct. So, I'm always reminding you guys anything prior to the semicolon is common language for this code family. And so, everything in it, the anesthesia, this is indeed a third degree burn. That sounds good. And yeah, debridement with or without skin grafting, all of that stuff is great. So, this common language is good. But this first code, 01951, this is for less than 4% total body area. And indeed, this patient has been burned over 54% of their body. So we can quickly get rid of 01951 right off the bat, which many of you spotted that right away. All righty. So then we move on to these other codes that are part of this code family. And indeed, the 01952 is for 4 to 9% of the total body surface. So, okay, that's good. All right. But we're going to need just a little bit more help in solving this one. We need the additional 9%. Okay. And it's letting us know with this parenthetical guideline that indeed we need to use 01953 in conjunction with 01952. So we're on the right track. All righty. You all have already taken note that it is for each additional 9%. Remember, we were talking about that. Pay attention to that code language. So for each, it means we're going to have to start doing some multiplying. Remember, I reminded you guys of that last week. Each time you see each, then we're going to have to consider some multipliers if it's indeed needed. And in this case, it's going to be needed because we can account for 9% with this code. All righty, but we're going to need to account for the remaining. So we have 54 divided by 9. All righty, so we're doing the rule of nines here. It indeed gives us 6. Okay, so this one counts for 1. We've got 5 left over, and so there we go. We've got 54 minus that first 9. That leaves us with 45, and that's divided by 9. That leaves us with 5. So that's how we got 01952, and then we have the 01953 times 5. Okay, we're going to need that. This particular one, it does not have that modifier on there, and neither does it have the 99140. Okay, it doesn't give us that code, which is the code for the qualifying circumstance, because this is indeed emergent. The patient would not survive without this operation, without this procedure. Okay, so you guys already deduced it. All right, so that's one way to solve it. Another way to get there, which many of you already saw, is we could use these physical status modifiers. Yeah, it's severe. They're not expected to survive. So we're going to need that P5. Okay, we're going to need that P5 modifier. And so it's not there and it's not there. All righty. Also, we're going to need this qualifying circumstance code here. All righty. And we're going to need this one. All righty, because it's emergent. We need that 99140 and it's not there. So there we go. Defined as if there's a delay, then there would be an increase in the threat to the life or body part, and it told us that. And so, yeah, we're going to need the 99140 as well. So that was another way that you could do it. And you see how quickly we can get there just simply honing in on even the qualifying circumstances. And we didn't even really touch the codes. Okay, so several ways. You guys, like I said, picked up on the C and D. We were able to quickly eliminate that. Okay. And then you guys start honing in, obviously, on those circumstances, the qualifying circumstances, and the additional modifiers needed. So I love what I saw in that chat. You guys are getting there. Forensic indeed. All righty. I'm going to have Miss Tina come and we're going to take a gander at our next scenario. Thank you, lady.
Okay, coders. Answer is A, 00320, B, 00326, C, 00322 or 99100, D, 00326 with 99100. A 9-month-old child was taken to the operating room to remove a laryngeal mass. What is the appropriate anesthesia code? Your time starts now.
All righty, I'm seeing lots and lots of good answers in there. I saw some folks go back and kind of make some corrections. Yeah, sometimes those parenthetical guidelines, they're real subtle. It'll just be one little sentence and it just changes the whole thing. But hey, many of you, after a little bit of a nudge, yeah, you got it. You were well on your way. So we're gonna jump right in and hone in on the things that you guys caught. So was quickly looking here in the chat. Yeah, you guys are good, better, and you guys are simply the best. So yeah, we've got this 9-month-old baby. Okay, and they're going to be taken to that operating room for removal of this laryngeal mass. And indeed, B00326 is the correct code. All right, we've got a 9-month-old. This is a little tyke. All righty, they're coming in for removal of this mass. Let's start going through these codes. We do have code 00320. This one, wrong age 1 year or older. Okay, so we're going to take 00320. We're going to take that one away. All righty. And so since it's wrong here, it's going to be wrong there as well. You guys know how I feel about the 2 for 1 or the BOGO. All right, we buy one, we get one off. All righty, so we're going to continue on now. We're down to these two. So the only thing separating these codes of 002, 00326 is the 99100 code. And so for me, I always go ahead and really I would jump down and solve like why this isn't so. But obviously my on clicks, I wanted to show you why this is indeed correct. The 00326, yeah, this is for anesthesia for all the procedures on the larynx and trachea in children younger than 1 year of age. And indeed, this little tyke is 9 months old. Okay, so here we go. Now we see it right here. Do not report 00236 in conjunction with 99100. It tells us right there. Alrighty. And then when we look at the actual code here, it lets us know that it is for anesthesia of patients of extreme age. Either they're younger than 1 or older than 70. That sounds good, but we've been told here at the code level, don't do it. And when we get down here, it tells us yet again, don't do it. If they're younger than 1 at the time of surgery, we have to see code 00326. And that's what we've got to do. And that's how you guys got to be. So, hey, we have a lot of checks and balances in place. And the thing that this particular scenario teaches you is to read the parenthetical guidelines. It doesn't even have to be a huge parenthetical guideline, but it can change the trajectory of your code choice. All right. So many of you change course on that thing once you let your eye go down there. You're like, oh, I see it now. So, hey, I'm telling you all this because I don't want you to leave anything on the table in that exam. Okay. So I want you to get every point that you are due. We're going to keep on rolling. I'm going to have Miss Tina come and read this next scenario. Thank you, lady.
Okay. Answer A 00834 with a P2 modifier 99100. B 00832 modifier P2 99210. C 49560 00834 1000 P2, and then D 00832. An anesthesiologist provides general anesthesia for a 72-year-old patient with mild systemic diseases who is undergoing a ventral hernia repair. How would you report the anesthesia services? 2.5 minutes and your time starts now.
All righty, you guys know what that means. I changed it up a little bit on the tune, but hey, well, that's 2.5 minutes. If you need to get your answer in there, I need you to slide it in. Yeah, I see one more coming in. Terrific. Yes, yes, yes. I do see that CPC certification in all of your futures. You guys are working hard, simply outstanding. So we're going to go through it. You guys have already deduced how we get there. So I'm going to go through and maybe I will shed some light on even another way to get there or just help to just solidify some concepts that you already understand. So the anesthesiologist is providing general anesthesia. They have a 72-year-old mild systemic disease, okay, and they're having a ventral hernia repair. All righty, so we're honing in on the anesthesia service. So right off the bat, we can eliminate C because, yeah, we don't use surgery codes to report an anesthesiologist's service. Okay, so we're going to take that one away. So already we've got it down to just 3. Alrighty, so if we take a look at 00834, and we know we're in very close quarters there because those first 3 digits are the same. So definitely take advantage of that as well. And actually the first 4. So we know that these are neighbors. Alrighty, so this 00834, this is for a patient that's younger than 1. All right, well, hey, this person has not been 1 in a very long time. And so we're going to take this particular code, yeah, off the board. And it's also telling us that we would not report this code in conjunction with 99100. So it's wrong 2 times over. All righty. So we're going to get that one out of here. Let's take a look at our last code, 00832. That's shared by both B and D. And the only thing separating it is the modifier here, and then this additional code, the 99100. Okay, so we are coding for anesthesia for hernia repairs, a lower abdomen. This is our common code language. And here, 00832, it's part of that family. And so, hey, yeah, this is a ventral hernia. Yeah, we need that. All righty. Yeah, ventral. So 00832, that is correct. But hey, what about this modifier? Remember, I was telling you last week I used to shake in my boots over the modifiers, but remember, modifiers are your friends. So let's see here. This patient has mild systemic disease. Well, I got a sneaky suspicion we're going to need to use a modifier for that. There it is right there, P2. And yeah, with the patient's age of 72, this patient is indeed older than 70. So yeah, we're going to need this code as well. And so yeah, 00832, it's missing those 2 modifiers. Alrighty, and so B is our answer. And you guys had already nailed it, boom, so quickly and so well. You guys are doing great. All right, so we're going to keep on moving because I'm trying to squeeze in as much as I can. So we're about 3 minutes before noon, so we're going to squeeze one more anesthesia scenario in before we move on to the next. All righty, so I'm going to have Miss Tina come and read us out on this one, and then we'll solve and move on in to our next session. All righty, here you go, lady.
Okay, A01260, modifier P2, 99100. B01272, modifier P3. C01272, modifier P2, 99100. D01270, P3, 99100. Mr. Johnson, 82-year-old, having been in poor health with diabetes and associated with peripheral neuropathy, is having a Fempot bypass. The anesthesiologist documents that he has severe systemic disease. What is or are correct for the anesthesiologist? Your time starts now.
All righty, you guys know what that means. It's been 2.5 minutes. So if you need to get an answer in, I need you to slide it on in there before we continue on our way. So I'm going to give you about 10 more seconds on this one, and then we're gonna start rocking and rolling. Okay, so many of you have gotten this one, and for those of you who were close, I mean close, I'm gonna show you why you just missed it. Okay, alrighty, so we're gonna jump on in here, and yes, to quote Mrs. J, you guys are outstanding. All of you are doing terrific. Okay, and hey, I'm just thankful that you're here with me on Saturday and continuing to hone your skills. And yes, if you missed some here and there, that's okay, because that's what a good study session does. It helps to solidify what you already know, and some things that you're still learning, it helps you to kind of refine it. Okay, so this is where I need you to be, because I want to see some CPCAs in the next couple of months. Okay. All righty, so here we go. All righty, so Mr. Johnson is 82, in poor health with diabetes and associated peripheral neuropathy. He's having a Fempot bypass, and he does have severe systemic disease. All righty, so we're going to take a look at code 002 7, let's see, 01272. All righty, so for 01260, it's for anesthesia for all procedures involving veins of the upper leg. Okay, so a fempop bypass is of the femoral popliteal arteries in the upper leg. Okay, and I already had somebody say I wasn't sure what that was. You really don't need to know what it is, but it does help to know sometimes what you need to hone in on. Are we coding for arteries or veins? Okay, but we can deduce it too with some keywords. All righty, so the Fempot bypass is for arteries. This particular code family is involving veins of the upper leg. So what do we always say? If that parent is wrong, then hey, the dependents would be wrong. But in this case, this is a standalone code. So this 01260, yeah, that's no good. We've got the wrong vessels on that one. So we're going to take that one away. All righty. We're going to move on to code 01270. This is indeed anesthesia for things that are arteries involving the upper leg. Yeah, that's where we need to be. We need some arteries, yeah, including the bypass graft. So yeah, that common code language, that's good. Alrighty, so we're going to star that one. We're going to star that one and see if we have anything that's better. We're going to do our due diligence. So again, right code family, common language is good, but this one is talking about a femoral artery ligation. There is no mention of that. Again, paying attention to those keywords. So yeah, no mention. So 01272, yeah, we're going to take that one away. And look at there, we got a BOGO, y'all. We got a buy one get one. Yeah, wrong procedure. That takes those two off, and already we're down at the one we need, okay, which is the 01270. So yeah, we'll take it and we're going to code it. All righty, so we already know what this 99100 is. It is for an anesthesia for a patient. Well, we're going to address this one too. All righty. He does have severe systemic disease, okay? And it's already told us that he's in poor health with severe systemic disease. So that's why we got that one. And then we're going to address this one. This is because of his age. All righty. He is 82. All righty. So we've got a code for that as well. And that's how we get to this one under the qualifying circumstances. All righty. That's why we need that code. That's why indeed this is your answer. So I think the thing that may have gotten some of you is understanding that the Fempot bypass, that it is coding for the arteries, not the veins. As soon as you get that, boom, you're on there. Everything else is like, nope, 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 nope. All righty. So how's everybody feeling? Is everybody doing okay? Because you guys are hanging tough with me. I appreciate that. You guys are giving it your all. Yeah, so Miss Dana's doing good. Is Miss Dana the only one? I need y'all to freshen up your coffee. All right, I see Giovanna. I see Renata, Andrea. Yes, yes. Water on deck. Everybody's ready to go. He's just like, good. Yes, that physical status exam, it can help you. When you are doing anything with anesthesia, if you start reading along and you're seeing things related to age, you're seeing something related to their physical status, like they've got severe systemic disease, or they've got to have this, or they aren't going to make it. Yeah, let these modifiers, these qualifying circumstances, these modifiers for physical status, let them help you to eliminate some things quickly, and then let's hone in on the additional codes and the code language to get it down to the right choice. Okay, yes, that's right, you could eliminate that A and B right away. Okay, you could just simply eliminate it because we didn't have enough of our modifiers and stuff. So yeah, different ways that you can approach these scenarios, but whenever you can even get just one off the board by sight and from reading the scenario, do it. All righty. Okay, so we're going to change gears a little bit. So give me 1 second. We are going to head on into we're going to start doing some radiology. Okay, so give me one quick minute here. I need to get this down and change gears. Okay, here we go. Let me get over here to radiology, collapse that down and collapse that down. I still have lots of anesthesia left, but I think that for the most part, what I have left with radiology will take us through. If for some reason you guys keep breezing through, then I will change gears, and we'll do something else if we need to. So give me 1 sec. I don't know why it's not wanting to cooperate. Let's see, here we go. That's what I need. And radiology. Okay. And there we go. All right. There we go. All righty. Now we're heading on to our next section, and we're going to do some radiology coding. Okay. So just quickly going over what your global charge is. All right. That's when the provider owns the equipment, employs the staff, and so they are entitled to the full payment. All right. That's your global charge. All right. So if you have a professional component and you're trying to figure out that 26 modifier, that's when you're coding for the interpretation, and it requires the physician's professional expertise. That's when you would add that. And then the TC, the technical component, you're going to add that. That's the cost of the equipment and the salary of the technician. Okay, so just honing you in on that. All right, so I'm not going to mute myself. I'm just going to give you these first ones. Which plane divides the body into anterior and posterior halves? Okay, so you guys can just pop it in the chat. We're just briefly doing this. There's no need to use time on this because you probably have it at the beginning of this chapter, or at least you should. Okay, so yeah, definitely use that book. This book should be a reference. You should have a couple of just things written down with various illustrations in your book to kind of guide you if you start thinking, I don't know. I'm not sure. So yeah, everybody's getting their answers in there. And yes, it is coronal. Okay, so if anybody wants to screenshot this so you can see the coronal plane here, this is the purple one, is going here. It is dividing the body into anterior, which is the front, and posterior halves, which is the back. The transverse plane is going straight across, straight through, like the abdominal area, kind of like right below the diaphragm, and it's dividing the body into superior and inferior halves, or upper and lower halves. And then the sagittal plane is going straight down the middle, really dividing it into, particularly if you see mid-sagittal, it's dividing it into equal halves if it's mid-sagittal, but it's going down the middle, dividing the body into left and right. And I know you're thinking, wait a minute, that's the right. Remember, it's always from the patient's perspective as well. Okay, so you wanna remember that. All right. And then which anatomic position has the patient lying at an angle instead of lying flat or directly on their side? Okay, this one's they're not quite they're at an angle, they're not flat, they're not directly on their side. So what is that? Yeah, yeah, you guys have it. You guys have it. Yeah, because I'm not gonna spend much time in that. You guys got to get the code. Yeah, it's oblique. Okay, so good job, guys. And yeah, and then quickly, the way to remember supine is up. Okay, the patient is facing up, and then for prone, all right, the patient is down right there, and you see supine, then the patient is up. Okay, so that'll help you to remember how to keep those particular ones straight. That's always helped me. Miss Marie shared that when I was going through, and I was like, yes, 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 that's helpful. So supine up, they're facing up. Prone, they're facing down, and yeah, oblique, they're not quite to the side or whatnot. They're kind of at an angle. All right, so. And here that's showing the skeleton right, anterior oblique. So it's on the right side again from the patient's perspective. Anterior is in the front, and then oblique, they're kind of at an angle. That the shot is coming in at an angle. All righty, so we're gonna jump on into our next scenario, and I'm gonna have my buddy Miss Tina come and read us out, y'all. Thank you, Miss Tina.
Okay, answer A, 70554, B, 70555, C, 70551, D, 70552. A patient reports to the hospital radiology department for a functional MRI of the brain. The technician asks the patient to perform a small task. He takes the image of the patient at rest and while performing the task. What CPT code is reported? You have 2.5 minutes. Your time starts now.
All righty, you guys know what that means. We are nearing time. If you are trying to decide between one or two answers, go ahead and make your choice and slide that answer on in there before we do the reveal, y'all. You guys are just doing amazing. I'm loving what I'm seeing in the chat. And if some of you just missed it just a little bit, I'm going to show you why and how you get to the right answer. All right, we're going to go ahead and jump on in there. And most of you have deduced what the answer is. And here are your keywords. We've got that hospital radiology department, functional MRI of the brain. The technologist is going to take the images, okay, while the patient's at rest and performing the tasks. So we do have answer A as the final choice. All right, so here we go. All righty. We have for our code, the first one we're going to take a look at is 70551. This one is simply an MRI, a magnetic resonance imaging of the brain. Okay, so this one we are looking for a functional MRI. All righty, so code 70551, yeah, we got to take that one away. We're going to continue on. Already we know, what do I always tell you? If this parent is wrong, who's wrong as well? Can the dependents be right? If the parent in the common language, if the common language of the parent is wrong, then we already know that anything that is a dependent of that code is wrong also. Remember the common language. So if anything prior to the semicolon, if that language is incorrect, anything that falls under, okay? So in this case, that common language, it is incorrect. And so it really doesn't matter that this one is with contrast and that one was without. It's that common language that disqualifies that whole code family. So 70552, that one is incorrect as well. We're going to move on. We're already at 50% already, just boom, right away. Okay, so I would say we've got some pretty good odds. So let's get down to what a functional MRI is. It's going to involve mapping of brain stimulation. But the other thing is that when it's administered by a technologist or other non-physician or non-psychologist, we have to use code 70554. So it's giving it to us right there already. So yeah, we have a technologist. So yeah, we need code 70554. And there's that code. We have the MRI of the brain, functional MRI. Yeah, I like it. I like what I'm seeing. Okay, so now we need to just do our due diligence though to find out what exactly is the code 70555. What is that saying? Okay, this first one is not requiring a physician or a psychologist administration, and that's good because yeah, this is the technologist that is doing this. So the other thing we have to remember, we don't report 70554 in conjunction with 96020, but in this case, there's no worry. We only have that single code, so that particular thing, that parenthetical guideline would not apply. So we're going to put a pin in it right here and take a look at this one. This one requires a physician or a psychologist to administer it. And we've already said, no, this is a technologist that's doing this. Okay, so we're going to take that one away. And then indeed, code 70554, that is our code. All righty. And so none of these things, the parenthetical guidelines that were on the bottom, none of those applied. Okay, so is everybody good? I think so. And so for some of you that just missed it just a peek, now you see what you got going on. Yeah, now you've got it. And sometimes it's helpful too if you have chunned your book to just simply write MRI brain, or here you would put functional MRI. Okay, just so you can grab it and you know, oh, that's just an MRI. Okay, that I don't need. Boom, boom, boom. Don't need that. And then here. All righty. So there you go. And many of you got that. So I'm going to keep on trucking and I'm going to have Miss Tina come and read you guys out with your next scenario. Thank you, Miss Tina.
Okay, coders. A, 72084. B, 72040. 72070. And 7100. C, 72082. D72083. A patient needing scoliosis measurement is coming in to have a standard anterior, posterior, and lat view of his entire thoracic and lumbar spine. What CPT codes are reported for the radiology? Your time starts.
All right, I'm loving what I see in that chat. And we don't even need all of the 2.5 minutes. I've already looked, and you guys already, you had about 15 seconds to spare, probably even a little bit over that. So you guys did fantastic. All right. So I'm not going to spend too much time on it because you guys already know how we got there. So, hey, maybe I can just offer a little something to just solidify what you obviously already know. This patient is needing scoliosis measurements, and they're going to have a standing anterior, posterior, and lateral views of the entire thoracic and lumbar spine. How is this going to be reported? And everybody resoundingly said C. That's what I'm talking about. So, hey, I'm going to move along real quickly. This particular one is a radiologic examination. And so, why did you guys already throw this one? Why'd you throw this one away? Okay, would you throw that one away? So what'd you think about this one? For this one, it is of the spine, but it is only coding. Yeah, it's only coding for the cervical spine. So yeah, already we're going to get rid of that one because we are focusing on the entire thoracic and lumbar spine. So automatically we're going to get rid of that 72040 because it doesn't mention anything about thoracic and lumbar. So yeah, that one's got to go. So hey, we've already gotten rid of that long one. That's a good thing. So we're going to continue on, and we have code 72081. This is indeed a code family, and all of this is some good code language. It is a radiologic exam of the spine. Yeah, it is of the entire thoracic and lumbar spine. But this first one, the 72081, it's one view. So it's not even one of our choices, but it wouldn't be good it wouldn't be one that would code for the thoracic and lumbar, but this is a good example that this code family is good because this common language is good. And you guys obviously already know that. So, I'm always just reminding you this common language, if it's good, we got to take a look at what's falling below. And so for 72082, we have 2 or 3 views. And indeed, we have 2 views because they're doing one for anterior, posterior, and lateral views. So that is 2 views. You didn't let that anterior, posterior fool you. You already know that is one shot that's going from the front to the back of the body. Okay. So for code 72083, that's for 4 or 5 views. We know that didn't happen. Go ahead, get that thing out of there. For code 72084, a minimum of 6 views. We know we didn't go there. So 72084, that one is gone. And so indeed, code 72082, that is the one that we need. And all of you got that right. I love it, love it, love it. Yes, so that's right. When you see a more specific code, you got to use it. So in this one, that's all we could do because this first one, this was for only one view. Even if it had been on the table, it would not have been correct simply because the code specific for that was for one view. But again, this common language, this is good. So I'm always drilling that into your head because when I was learning coding, I understood that, but sometimes I would be thrown off by like, well, if this one isn't, but this is because that part is specific to this code, but this common language, that's some good stuff. And these dependents, it took care of what we needed. And we found what we needed in this code, 72082. So I'm going to keep on rolling because you guys already said answer is C. Alrighty, so I'm going to read us out on this one and get you guys going on it. So we have A 71046 with a 26 modifier, 74150 with a 26 modifier. We have B 71046, 74150, C 71046 with a 26 modifier, 74150, D 71046, 74150 with a 26 modifier. A 41-year-old male is in his doctor's office for a follow-up of an abnormality which was noted on an abdominal CT scan. He also had a chest x-ray, PA and lateral views performed in the office due to chest tightness. He stated he otherwise feels well and is here to go over the results of his chest x-ray performed in the office and the CT scan performed at the diagnostic center. The results of the chest x-ray were normal. CT scan was sent to the office and the physician interpreted and documented that the CT scan of the abdomen showed a small mass in his upper right quadrant. What CPT codes are reported for the doctor's radiologic services? All right, coders, I'm going to give you 2.5 minutes and your time, it starts now. All righty, I saw lots of good stuff going on, lots of good stuff. So hey, I gave you a few extra seconds in there. I saw a lot of good things going on. I think you guys are really getting the hang of this. I love seeing it too. All righty, so we're gonna go ahead and take a look at how we got there. And for those of you who almost got there, we're gonna get you real clear so that the next time you will not let this one slip through your fingers. Okay, so oftentimes it's just something subtle, because many of you, from what I'm seeing, you guys are at the point that you are definitely understanding the concept. So it's just a matter of just continuing to just refine it. That's all it is, y'all. All righty, so again, many of you have already said that the answer is indeed D. Okay, so we're going to take a look at why. This patient is 41 years old. They're at their doctor's office. They're going to have that chest x-ray, PA and lateral views. Again, it's performed at that office for chest tightness. They had the CT scan performed at the diagnostic center, and the physician has interpreted and documented it, and they have indeed found a small mass in the right upper quadrant. Okay, so the interesting thing about this one, as you guys have already seen, is that all of the codes are the same as far as the first and the second listed code. And the thing that separates it are these doggone modifiers. We can't get rid of them. Alrighty, so again, we're just reminding you what that professional component is. Okay, that's going to pay for the doctor's services, and the technical component is going to pay for the equipment and the technician. Okay, so if you don't already have something to kind of remind you of that in your CPT manual, then I suggest that you do it so that you can quickly have that visual, like, oh yeah, that's what that one's for, that's what this one is for, as you begin to really dissect through the scenario to arrive at the correct answer. Okay, and in this case it is indeed D. And let's take a look at why. So we have already, you guys already know all of them are the same. It's for a radiologic exam of the chest. We have two views, okay, because indeed we have the PA and the lateral. So that's where the two views come from here. All right. And then we have the CT of the abdomen. All right. And we have there abdominal CT. So 74150. All right. So we're going to talk about these modifiers with the modifier 26. These are just some notes that I always had to just get it clear. I would have something really detailed to have me clear, and then I would kind of condense it. So this is like a little bit of my longer version, but sometimes, like I said, I would fluctuate it. Sometimes I'd be clear and sometimes not so much. So this particular way of looking at it always spoke to me. For modifier 26, the medical professional is going to read that radiologic report at the hospital. Say they're at the hospital, but they're not employed by the hospital. We're going to use modifier 26. Okay, they're at the hospital. They call this person in. They're reading it, but they aren't an employee at the hospital. We're going to use 26. But if the hospital owns the equipment and the person who's reading it, say the radiologist, works at the hospital as well, then they're both part of the global package. So no modifier 26 is reported. If the patient goes into the office and it's the office and they own the equipment, and the provider at the practice, obviously they work there too, they read the x-ray and they provide the report, then the office is going to bill for the global procedure, and no modifier 26 would be appended in that case as well. But if the procedure is also, if it's performed at a surgical center and it's indicating that it's not a hospital, the provider is not employed by the facility and just came into the surgery center and they're reading the reports for them, then we're going to need the modifier 26, because their professional service of reading that report has been provided. Okay, and obviously this provider, they're not owning the equipment because they're just coming into the surgery center. Alrighty, so in this case we're talking about, we know the patient was at the doctor's office for one of the tests performed, and then they were at a diagnostic center. So because there was no mention of a hospital, we're just going to take that one away. Okay, now here we go. So we have all these codes. Now we got to figure out what was performed where. So let's take a look. We have the x-ray. Okay, so we've got the chest x-ray, and where was that performed? That one, he was in, let's see, he was in the doctor's office. Follow up for the CT scan. The chest x-ray was performed in the office. Okay. So because it was performed in the office, all righty, then the office, they own the equipment. They're going to be reading it there. All righty. So no modifier 26. So already, because he's in that doctor's office, it's performed in the office, that 26 is not needed. So we see it there and there. We can take that off. Okay. So now we're down to, he had that CT scan, but it was performed at the diagnostic center. Okay. So if it's performed at the diagnostic center, okay, and the physician, they interpreted and documented that CT scan. Okay. So surgery center and not at the hospital. This provider, they're just coming in and they're reading it, and it's telling you the physician interpreted and documented. And I can tell you right now on the exam, it'll tell you the physician and employee of. You'll know, okay? Or if you just see employee, the physician interpreted and documented, then that lets you know they're just coming in offering their professional services, okay? And so already, once we get rid of this, we already know B is wrong, because it has no modifiers. And we're going to need that 26 because they came in and they read that CT scan. So this one has none of the modifiers. So that one's gone. And then this is your code because they just came in and they interpreted that particular CT scan for the surgery center. Okay. So I think many of you already had that down, but I just wanted to offer you guys an explanation of what that looks like. Okay. So go ahead and you can grab this particular screenshot, and then before we end, I will go back. Andrea, remind me of this one, and then I'll go back and pull it up. Okay. So we can squeeze one more in. Okay. And so here's another one, another way. Now that you understand how the modifiers work, okay, so how might you solve this on site? Okay, so let me show you. Alrighty, so the chest x-ray performed in the office. Alrighty, so because it was performed in the office, then we know this one, that's the chest x-ray. We don't need the 26 modifier because they're going to use the global package, so they wouldn't be charging for that. All right, yeah, the chest x-ray is part of the global code, so everywhere we see with that on there, we're taking it off. All righty, the next thing with the CT scan, all righty, we're going to take this off because we need that modifier 26 because they are indeed interpreting that CT scan at the diagnostic center. Okay, that one had no modifiers, and then we could get to it that way as well. Okay, so that was another way you could do it. Again, another case, once you are clear which of these codes represents what, this is the chest x-ray, that's the CT scan, then you can start deducing, because that's what you were going to have to do anyway. Now you got to hone in on what these modifiers mean. So I hope that helped. If you already understood, and many of you did because you got to the right answer, but I hope that it gave some of you that were kind of going back and forth on it, that it gave you another perspective on how to keep those particular modifiers straight in your head. Okay, so I hope that was helpful. All right, we're going to keep on going because we need to get some more coding in. All righty, come on, Miss Tina. All right, lady.
Okay, answer A 77080, B 77081, C 77078 or 77078, or D 77077. The physician requires a dual energy aspirometer for the foot. Which code should be reported for this diagnostic test? You have 2.5 minutes and your time starts now.
All righty, you guys are just doing it, doing it, doing it. I'm loving what I see. I do believe the ability to code is you guys' superpower. That's what I'm believing. I'm working with a whole bunch of superheroes today. All righty, this physician is requesting a dual energy absorptometry of the foot. Alrighty, so which code are we going to report? And indeed, we better report 77081 in this particular case. Alrighty, so we have for our first one, 77070. Well, this is a joint survey, single view. We really don't even need to use to even read the rest of it. Once we see joint survey, and we're looking for dual energy absorptometry, and that's not what that code says. So we're going to take that one immediately away. And our next code, 77078, this is indeed a CT scan or computed tomography. Nope, that's not it. I'm not even going to continue moving on because it is not the correct procedure. So see how quickly we're moving on, okay? We're moving on with it. Once we see that we're not even at the right exam, it's no need in going all the way through. Don't do that, okay? I have a tendency to love details, and I had to catch myself during the exam. I wanted to read the whole thing, even when I knew that wasn't it, but I just had to make sure it really wasn't it. Don't do that, okay? Once you know right away that I could get rid of that code, get rid of it, all right? So we have code 77080. Oh man, this is saying dual energy X-ray absorptometry, a DXA. Yeah, that's some good stuff right there. I think we need to probably hold on to it, see what else we got going on. All righty, so all of this stuff is good stuff. All right, so we're gonna hang on to it because yeah, that's what we're seeing. But the code that's specific for code 77080, it's for the axial skeleton. It's talking about the hips, the pelvis, the spine. So we're just in the wrong spot on that one. So code 77080, yeah, that one's no good. And so it's going to leave us with code 77081 because we indeed need the appendicular skeleton, which is going to include your appendages. Okay, that's what appendicular. It's the peripheral, the radius, the wrist, the heels. It's the appendages away from the trunk. Okay, so if you notice all of these things, the axial skeleton, these are things that are your trunk, the hips, the spine, but the appendages, things that are in the peripheral, considered the peripheral of the body, that's what this is coding for. And that's indeed what we need. We're talking about the heel. Yeah, that's part of the foot. So yeah, code 77081. That's what we need. This particular parenthetical guideline doesn't apply, so we don't worry with that. And then indeed, B, that is our answer. And you guys, hey, you guys nailed it. I'm loving what I see. So like I said, the only reason I like to go through it is again to solidify what you already know, perhaps offer something that'll help you tweak it to get you there just a wee bit faster. And again, the one thing that I would share with you is once you know that that is not the right procedure, move on. Scratch it off and move on, okay? Don't do like I did on it. I was doing that for probably about 10 or 15 minutes on that exam, just reading through because I wanted to know that I know that I know that I know. Don't do that, okay? Just get to the business of coding. Alrighty, so we're going to continue to move on, guys, and let's take a look at our next scenario. Okay, so we've got time to get this one in. We're going to start with our answers: A, 76818, B, 76819, C, 76815, D, 59025, and 76818. A 25-year-old female in her last trimester of pregnancy comes into her obstetrician's office for a fetal biophysical profile, or BPP. An ultrasound is used to first monitor the fetus movements, showing 3 movements of the legs and arms, normal. There are 2 breathing movements lasting 30 seconds, normal. Non-stress test, or an NST, of 30 minutes show the heartbeat at 120 beats per minute that increase with movement, normal or reactive. Arms and legs were flexed with fetus head at its chest, opening and closing of a hand. 2 pockets of amniotic fluid at 3 centimeters were seen in the uterine cavity, normal. Biophysical profile scored 9 out of 10 points, normal or reassuring. What CPT code is reported by the obstetrician? All right. I know that my Saturday coders are ready. All righty, I'm going to give you 2.5 minutes on this scenario, and your time, it starts now.
Thank you for watching an AMCI exclusive presentation.
All righty. I see you guys in there. Beautiful job. It was kind of going back and forth between A and B a little bit. Let me jump to it because we're getting close on time and I don't want us to get kicked out of this thing. All righty. We have a 25-year-old last trimester of pregnancy in their obstetrician's office for a fetal biophysical profile, or BPP. That ultrasound is monitoring that fetal movements, the fetal movements of the baby, and we did have a non-stress test performed. All righty. And then it's giving us the biophysical profile of 9 out of 10. And indeed, the answer is A. All righty. So we're going to jump to it. You guys, like I said, teeter between A and B. And then some of you caught it after just a little nudge. So the 76815, you guys already knew with this one is ultrasound, pregnant fetus, pregnant uterus, real time, all of that good stuff. But this one is limited to the fetal heartbeat. And indeed, we're doing a little something more. We are doing a biophysical profile. And so 96815, that's not it, because we had a little bit more going on with this particular visit. All righty. So we're going to continue on. Yeah, 76818. I'm liking what I see here. It is fetal biophysical profile. All right. That's some good stuff. Yeah, it said we had a BPP right there, fetal biophysical profile. We better star that and hold what we got. But let's take a look at the dependent of this particular code. Yeah, fetal biophysical profile, but this one is without non-stress testing. So we did have the non-stress test. So 76819, yeah, we got to take it away. So let's see what we got going on, because this 76818, it is indeed in both A and D. So why is 59025 not part of it? This one is a fetal non-stress test. Yeah, we don't need that. It's not reported separately because it is included with this. Here it is, non-stress testing. So yeah, that would be overcoding, and we don't need the 59025 because the fetal non-stress test, it is included in the code language that we need here. And if B got your, see, this is why I'm always telling you, this common language, yeah, that applies to both. But yeah, specific to this code, it is for non-stress testing. This one is without. And that was the deciding factor. This patient did have the non-stress test. And that's why code 76818, that is why that is your code. And then you have your parenthetical guidelines that in this case, they did not apply. Yeah, it's easy to get that thing flipped around, okay? So yeah, you got to just hone in on it. No worries there. All righty, so that is it.
Thank you for watching an AMCI exclusive presentation in partnership with AAPC. Until next time.